Hi, everyone. My name is Dolma Tsundu, and I'm the CEO and founder of Flutter Care. We're building wearable technology to help monitor fetal health remotely. I'd like to introduce you to my friend Nadine. For 15 years, Nadine was a policy analyst with the Government of Canada, and she loved being able to contribute to her community as a public servant. Nadine and her husband were really excited to learn that they were expecting a baby girl, Judith. And Judith was full of energy, a kickboxer inside of Nadine's belly. But just 2 weeks before her due date, Nadine noticed Judith's movements becoming less frequent and weaker. So she went to her doctor, who took Judith's heartbeat, told her that babies just ran out of room, and sent her back home. And 2 days later, little Judith's heart stopped beating, and Nadine's world changed forever. On September 18th, Nadine held her daughter for both the first and the last time. The guilt and grief she experienced after her stillbirth was debilitating. She was hospitalized for PTSD and depression, and to this day has been unable to return to work. Nadine's story is not uncommon. Every 16 seconds, a baby around the world is stillborn. And in high-income countries like Canada and the US, 30% of these deaths could be prevented. Stillbirths also put mothers at risk, with a 14 times higher chance of experiencing severe complications during delivery. With only sporadic checkups, parents are on their own to recognize when something is wrong. In Nadine's case, she did everything right. She took care of her health, listened to her body, and took action when she felt something was wrong. But she had an undiagnosed maternal infection that was cutting off little Judith's oxygen. So how can we enable providers to offer the best care? At Flutter Care, we're developing a novel, non-invasive wearable device to continuously monitor maternal and fetal health from home and to reduce the time it takes to receive medical attention. Currently, parents are manually tracking fetal movements, which is really difficult to do, but it is one of the most established and important indicators of fetal well-being. We've developed a new method of imaging the fetus in the womb that allows parents to track movements. And so this technology helps to increase compliance, decrease anxiety, and captures data that will fundamentally change how we understand stillbirths. Currently, technologies that exist are really only focused on fetal heart rate, which can be misleading, whereas our technology is mastering fetal movement detection and combining that with fetal heart rate technology. And so with this, we have the power to detect distress even sooner. We've also integrated our technology into garments that mothers are already wearing, and this will help to allow for continuous monitoring and also does not restrict user mobility and allows for smoother adoption. You can see on the left here is a competitor device from Nouveau, and they have developed a remote fetal non-stress test, but as you can see, it's very bulky and people cannot be wearing this continuously. Beyond this, we're also designing a whole new way to experience and remember pregnancy, such as through our butterfly simulations. So we have built defensible technologies with our patents pending. We've been able to demonstrate accurate detection and have received safety approvals to use our device with humans in clinical studies. So our device is currently at technology readiness level 7. And we will be actually testing our device with human subjects next week. We've also been supported by key deep technology programs such as Canada's Hardware Catalyst Initiative, where we're able to access an $11 million prototyping lab, and that's where our R&D team currently works out of. We've also been backed by Techstars Industries of the Future, which was Techstars' only program that was partnered with a scientific laboratory, a national scientific laboratory. And then we have also been backed by the National Research Council, who continues to fund our R&D efforts. So our device will be available in market from 2027, but before then we have a standalone app. And this app allows families to manually track fetal movements. And this has provided great validation for interest in our hardware technology, which essentially makes tracking fetal movements even easier. This technology has been used by over 6,000 families across more than 140 countries. We have been promoted by the International Stillbirth Alliance and the Washington State Department of Health. And we're collaborating with key health authorities like the Public Health Agency of Canada towards a national strategy to prevent stillbirths across the country. So in terms of our business model, with our app, we will have a subscription fee, and we're estimating that each user will use the app for at least 5 months. So that's the 3 months in the third trimester where people should be tracking fetal movements, the month ahead of that, and the month postpartum. And this will be a loss leader for our medical device, which will be at a unit cost. And so with a focus on the 2 million complex pregnancies each year across Canada, the US, and the UK, which would be our first markets, this means that we have a beachhead market of $4 billion per year. We will launch our app as a D2C model, and then we also have our device available as a consumer purchase through B2C channels, such as through pharmacies and electronic stores. But eventually our goal is for this device to be reimbursable through insurance companies. We know that there is an economic impact of stillbirths. So each stillbirth has direct costs of over $9,000 for the healthcare system and for families. And then a pregnancy costs around $19,000. And if you have a complex pregnancy, that's $27,000. And if someone has a loss, there is a very high chance, 85% of these families become pregnant again within 1 year. So when you think about the investment for each pregnancy, there's a real benefit to having a device that can help ensure the success of the first pregnancy. And then we also see ourselves working with employers through employee benefits packages. So in terms of reaching our customers, currently we've been able to reach our users through advocacy groups, social media, and events. But in the future, we'll be targeting some of these larger channels, such as health authorities and professional organizations like the Society of Obstetricians and Gynecologists of Canada. So while most of our marketing, or all of our marketing to date, has been organic, we will be able to see also the impact of working with influencers through different social media channels. So our device is currently going through our first in human studies. We will go through 3 phases of clinical studies with the goal to get to our full regulatory submissions by the second quarter of 2026. And so far, we've been able to get our ethics approval and our safety testing completed. And we're exploring clinical sites. So we've already received interest from the University of Tennessee Medical Center in the US, as well as we're going through the Healthy program based in Hamilton with St. Joe's. So far, we've stayed very lean as a team and really focused on the skills required to build strong IP and defensible technology. My background is in engineering, and as a student, I was the sole national recipient of the Engineers Canada Gold Medal Student Award, and I've also founded 3 different organizations. I bring my experience as well as a birth doula who has worked directly with families during pregnancy. My team has led hardware development at companies like Sanctuary AI, conducted PhD research in biomedical sensors, and have numerous publications across medical imaging. And our mentors are helping to fill the gaps. They have taken medical devices to market, companies to IPOs. We're receiving great mentorship on the product side as well from both compliance and development. And we're receiving clinical mentorship from key leaders, such as the former Canada Research Chair in Maternal and Fetal Medicine. And so our clinical mentorship spans both obstetrics and neonatology. So we will be raising a $2 million round, which will get us through 3 phases of clinical trials and our FDA de novo submission. It'll also get us to a product lockdown and help us to develop our pre-production units. And we expect our Series A to begin in the second quarter of 2026. There is great potential within this space. We've already seen comparable companies like Owlet and Nuvo both go public, whereas we've also seen major acquisitions from key companies such as Samsung. So little Judith's legacy does live on, and we believe that there is hope. As an example, Nadine and I last year worked together to successfully advocate for new national fetal health surveillance guidelines. So now in Canada, every family from 26 weeks should be regularly monitoring fetal movements. And we've also now moved away from this oversimplified guideline, which was 6 movements in 2 hours, but now people are being encouraged to understand their baby's unique baseline. And so with this, our technology is making this much easier for them to do. We believe that pregnancy is a reminder of what a miracle it is to be human. And so from the very first time that you feel flutters in your belly to the first time that you're holding your baby, we want every family to have a positive experience. Thank you.
Thank you, Dolma. You were 11 minutes. All right. Okay, Kelly, do you want to kick us off on our feedback this time?
Yeah, excellent, excellent. You use the time really well, Dolma. Your pace of speech is really good. That's a really important piece for me as a listener. You take natural pauses, you're not rushing. You leave space for me to consume what you tell me rather than just moving through, which is really important. I love your brand, by the way, and it's important. It's not just I think it's a good brand. And the way you connect the brand to the story is really good because it's memorable. I really liked your intro, introducing with a user journey. Really simplifies, what is a medical condition and a medical problem, and to non-medical folks that might invest, it's a really great way to share that. You talked about framing the problem, framing the solution. You had a slide, I don't remember which one, and you sort of said we address all these areas, compliance and a whole bunch. It was like a string. I would spend a little more time on that. And you used action words which weren't on the slide. So in one case, you're like, we increase this, we decrease this, we improve this, we resolve this. Those words are actually really important because I don't know what you're doing to affect those categories. I don't know enough about your business. So I don't know when you see anxiety, I don't know, right? A little more context. And any way that might even be too many, any way you can connect those things to the next series of slide would be great. So this is how we're addressing anxiety. Sorry, this is the thing, I couldn't remember them all, but you had a very clear feature list that says we're addressing all these things. And then, move into like, here's how we're doing it. For me, what was unclear to me, I was like, oh, it's a medical device. And then I go, oh, you've got all this traction with an app. And then you went back to the device. So it seemed, and I think it's a great strategy, right? You've got a great user base, you've got validation, but am I investing in just the medical device? Is that the ask? It's for the medical device, or is it for more than that? Okay.
Yeah, primarily the medical device, but then we want to launch another version of the app that would be paid. So it's like kind of increasing the suite of offerings in the app so that we can, kind of build off of that model.
Got it. And you had a slide called hardware traction, which is really your validation, right? That's your evidence. Is that what that is on the device?
So that's what we've been able to do to date with the device. So it's showing how far along the hardware technology is, because the app is already available and is not really our focus right now. We're primarily a hardware company right now. So I'm trying to show people just like how far along we've gotten with the hardware to date.
Out of curiosity, because it might help the story a bit too, did you start down the software path and realize that there was a hardware play, or was it always intentionally hardware and software was a way to get the market?
Yeah, it's such a good question. So we started with the hardware vision, realized that there's an opportunity in software, and that it could be really helpful for the hardware. And then we went back to hardware.
Okay, no, that makes sense. It wasn't clear and then it was, so maybe it was just an order thing. You talked about the different pricing. I was curious, and it's your strategy, but it did seem unusual. It stuck out to me that you had a three-part strategy, and the end part of your strategy was a B2C on the hardware. So the intention is the first target audience is consumer to purchase that $2,000 item. Is it a parallel strategy, or is it you need to sort of prove it out and sell it to consumer and then sell it to business?
Yeah, so I think maybe what's confusing there is also that we're talking about insurance. And so I was trying to show like B2B, like how we would be working with other larger organizations, because our device is a de novo device and there isn't an existing reimbursement code. That means it takes time to actually establish that. And so the idea is like we would go first to consumers and then be able to prove out that this is something that should be reimbursed from like the economic impact kind of lens. And once we had that reimbursement code established, then that would start funneling in.
Okay, that makes sense. Maybe more clarity on that.
I could spend more time there.
And
Yeah.
then who is so then your target audience for the medical device is any pregnant woman, right? That, is it, I'm kind of wondering, is there any pathway that you've thought about in that private practice clinical space? Like, could they be the, kind of that first,
Yeah,
customer for you?
that's a good question. Yeah, we used to have on that business model like pilot studies, pilot programs. So like they could purchase it for the pilot program. So like the private practice is using it. But I took it off for now because I felt like it was confusing and not as established. It's also not really clear if people would pay for the pilot. So that's why I was, yeah, just keeping it off. But it's a good question. I should talk about what those institutions look like that we would be working with.
Yeah, and then my last comment was just on the so the roadmap was really good. It was really clear. But then you talked about clinical sites, and again, I'm like, oh, I thought she said you were going to clinical sites. I thought your goal was so again, I was like, who are you selling to? And it's okay to have multiple. Actually, it's not a bad thing to have many people to sell to, but it still wasn't clear. Like, yeah, we've got a clear vision. This is who we're going to sell to, because I heard 140 countries. So you're selling everywhere to every person. Do you have like a clear focus on who your customer is when and when you can sell to them?
Yes. So I had added it on the bottom of that revenue model slide. Like I used to have like a separate market slide where it was like, oh, complex pregnancies. But then I was like, if I'm talking about revenue, like maybe just combine it there. So the focus is high risk pregnancies and pregnancies after loss. Yeah. So it probably needs to come out a little bit more.
Oh, yeah, perfect.
Yeah.
Yeah. That's it. Thank you. Very, very good.
Yeah. Thank you so much.
Thanks, Kelly.
Okay, a very, very good presentation. I think your story at the beginning was not only a good story, but you did it very, very well. You had me crying. So I'm not sure if it's a good thing or a bad thing, but it worked very well. And so the way you did it was absolutely excellent. So I won't repeat any of the things that Kelly said, but there was one slide. I always struggle when I see these life sciences companies that are saving lives, and I say, but now we got to talk about dollars. It seems so crude, but at the end of the day, you have to talk about dollars. So you had a slide, and in your words, you're giving a whole bunch of useful information about money saved and whatnot. I think you should take those out of the words and put them on the slide, because I can't remember the numbers. But at the end of the day, insurance companies make financial decisions, and we need to make sure that we understand what those financial numbers look like to help them make the right financial decisions. So I think making that slide much clearer, and don't do it in just the words, would help a tremendous amount. And the biggest question in my mind is still the whole go-to-market strategy. I love your idea of doing the app first, because that gives you an easy way to start to build a customer base.
Yes.
And so I think that's going to help an awful lot. But still, there's an awful lot of, I said, it's a consumer sale at the end of the day, because there's an awful lot of pregnant women. So how do you find them? How do you sell to them? Do you use channels? I think the whole go-to-market strategy, I think is something that needs to be much clearer. Because in any business, focus is always the most important thing at the beginning. So yes, you've got every pregnant woman in the world as a potential customer, but at the beginning, you need to be very, very highly focused, and you need to understand what that focus looks like.
Okay. Yeah, that makes a lot of sense. It's a part of the pitch that I can kind of clean up a little bit, make a little bit more clear. Yeah.
Yeah.
So I think right now it's sort of like disjointed. So how do I like kind of bring it together?
Yeah.
Awesome.
That's all I had. It's a great presentation.
Thank you.
Great. Thanks, Lori. Dolma or Euban, any questions? We still have a few minutes if you had any further questions for Kelly or Lori while you've got the time.
I would like to emphasize that both presentations were really good. I spent the last 2 hours before this doing pitch coaching as well. And
Mhm.
your two were head and shoulders above the other ones I saw this morning. So they were, we'll give you lots of feedback, but they were very, very good.
Fantastic.
Thank you.
Thank you.
Well done, guys.
Thanks.